I want to say a few words about Senator Menendez because I met him many years ago, and I'll just like to tell that story. I got a call from one of his aides, and they said, you know, we would like to put together a panel of experts in the field of treatment, prevention, and recovery. We don't want any press. We don't want any publicity. The senator just wants to learn about substance use disorders, about how to treat substance use disorders, the barriers to treatment, how we could expand access, how we can improve the quality of care. And I was incredibly impressed because that's exactly what happened. The senator came in without any press, without any fanfare, sat down and listened to what everyone, we had about 20 experts in that room, and listened to everyone, listened to what they had to say, asked important and meaningful questions. And I sat right next to him and took notes, took notes. And at the end of that meeting, he precisely and accurately summarized everything, every concern that each one of those experts had, and made a commitment and made a promise that he would go back to Washington and address those issues. And he has kept that promise. And you don't have to take my word for that. All you have to do is look at his voting record, look at the bills that he's sponsored. And they're numerous, including, to start with, the Affordable Care Act, because that has been, in my opinion, at least during my professional career, the most important legislation to expand access for substance use disorders. And the senator supported that bill, he voted for that bill, and he has been fighting the fight against those forces in Washington who have wanted to repeal it. It would be a disaster for our efforts in fighting and battling the opioid epidemic if that bill, if the Affordable Care Act was ever repealed. It would be a disaster. So there's a long list of bills and legislation that the senator has supported, has sponsored. It has brought millions of dollars into this state and has helped us to provide services and effective, more effective and better quality services to folks with substance use disorders, and especially those with opioid use disorders. And for that reason, as a person in recovery and as a treatment provider, I am very grateful to the work that Senator Menendez has done, and I am very honored to introduce Senator Menendez.
Well, thank you, Mike, for the gracious introduction. More importantly, thank you for your work and all those who join with you in making a difference in people's lives. Mayor, thank you for joining us. I'm sure when you say to your wife it was 2 life sentences, you say 2 glorious life sentences. What's that? But we appreciate your leadership, because it takes leadership sometimes to have centers that can turn people's lives around and not see it as a negative, but as a positive force in a community. So we congratulate you on that. I met Mike sometime back at Eva's Village in Paterson, New Jersey, where he was a tremendous source to me in our fight in an uphill battle in Washington to ramp up the federal response to the opioid epidemic. So I appreciate your continuing work, appreciate you welcoming us here to John Brooks, and I also appreciate our fellow New Jerseyans who are going to talk to us shortly about their experiences, and I'm very thankful for you to share your stories. It's never easy, and I think it's incredibly important because it may affect the lives of others or else, and as well as have those who are covering us today get a sense of why we are fighting for what we are fighting for. So I appreciate it a great deal. In recent years, too many New Jerseyans with addiction to highly addictive opioids have struggled mightily. Too many fathers and sisters, mothers and brothers, friends and neighbors have lost loved ones to overdose. This challenge, public health challenge, does not have a sense of race or gender or ethnicity or income. It is cross-cutting in our state. Too many communities continue to grapple with the scourge of prescription painkillers, heroin and fentanyl, which can be up to 50 times more potent than heroin. In 2017, this epidemic claimed the lives of more than 2,600 New Jerseyans, and this year we are at the risk of surpassing 3,000 deaths. It's a grim milestone that I don't want to see New Jersey families suffer. That's why I've made combating the opioid epidemic a top focus of mine in the United States Senate. Back in 2016, I helped pass CARA, the Comprehensive Addiction and Recovery Act, to a large degree. Insights that I gained from that roundtable and subsequent conversations helped us instruct some of the efforts of what CARA did. This legislation marked the largest federal response to a drug epidemic in 4 decades. But I was frustrated that while we passed legislation to create the structure of a federal response, it didn't include funding necessary to match the severity of the public health crisis that we have. This past spring, I pushed relentlessly for more opioid funding, and I was pleased that we achieved a budget that provided an additional $6 billion to combat opioid addiction. And this fall, I was proud to vote for a bipartisan omnibus spending package that invested $3.8 billion in treatment, prevention, and recovery. These critical investments will save lives, and I'm committed to bringing New Jersey its fair share of federal funding. In September, I secured $30 million to improve mental health and substance abuse services at our community health centers, equip more of New Jersey's first responders with anti-overdose drug Narcan, and expand access to highly effective medication-assisted treatment, something I know has been a priority here at John Brooks. And just days ago, I was proud to announce nearly another $3 million for New Jersey to bolster law enforcement's crackdown on the illegal distribution of heroin, meth, and other opioids across the state. Likewise, as someone who believes we need to do more to protect children caught up in this crisis, I'm glad to see $750,000 go to the Center for Family Services in Camden for this very purpose. I'm proud that several of my own pieces of legislation were included in the recently passed Opioids Crisis Response Act of 2018, which was signed into law just last week. Those bills include measures to reduce the time that children spend in foster care and expand access to family-friendly residential treatment programs. Keeping families together during recovery is not only an important motivator for those trying to get well, but it's also a strategy to shield children from trauma that can last years. I'm also pleased to have fought for measures that allow Medicaid to cover more inpatient psychiatric care. Arbitrary caps that, for instance, block Medicaid from paying for inpatient care in facilities that have more than 16 beds is just plain foolish in the midst of a public health crisis. And finally, I'm proud that Senator Booker and I successfully fought for the inclusion of alternatives to opioids in the emergency department as part of this law. That means more hospitals across the country will be able to adopt the acclaimed pilot program pioneered at St. Joseph's in Paterson, which led to an 86% drop in the use of opioid-based prescriptions over the past 2 years. We need to start with a process that doesn't get you addicted in the first place, and especially when we are medicating people for pain, and then we ultimately not just take care of their pain, but then we get them pain for life by an addiction. At the same time, and I appreciate Mike mentioning this, as we talk of the need for medication-assisted treatment and coverage for inpatient psychiatric care, we cannot ignore the Trump's administration's relentless effort to kill the Affordable Care Act. Nearly 1 million New Jerseyans, I'm proud as one of the authors of the Affordable Care Act, that nearly 1 million New Jerseyans have coverage today thanks to the Affordable Care Act. And that includes coverage for the treatment of substance abuse and mental illness. If we're serious about beating opioid addiction, we must be serious about protecting access to affordable coverage. It's time for the Trump administration to drop its assault on protections for pre-existing conditions, because as any provider in this field will tell you, recovery is a lifelong process. Substance abuse is a pre-existing condition, and the last thing we need to do is to have health insurance companies denying treatment of people simply because they struggled with addiction in the past. Likewise, it's time for Republicans to end their relentless quest to turn Medicaid into a block grant program. Here in New Jersey, Medicaid is the #1 source of coverage for substance abuse disorder. I was asking Mike, what's the payer mix? And our CFO here told us that Medicaid is a single most significant source of the payment for those who are getting treatment here. An Urban Institute report found that no other state in the nation would be harder hit by this plan to put Medicaid into a block grant program. We would lose $31 billion over the next decade, jeopardizing coverage for seniors, the disabled, and yes, the addicted as well. To any Republican who says we cannot afford to provide every American addicted to opioids with a path to recovery, I say we really can't afford $2 trillion worth of tax cuts for the largest corporations and the wealthiest individuals. We need to turn people's lives around. We'll continue to put the needs of patients and families first. We'll fight for bold new investments in medication-assisted treatment, inpatient services, and resources to reduce overdoses and help those in recovery build a healthy life. That's what Democrats hope to do, try to finally catch up with the crisis and get ahead of it as we continue to move forward and seek to reduce the numbers who are addicted in the first place and help those who are addicted turn their lives around. Look, I tell my friends in law enforcement, yes, we're working really hard with you as well to get fentanyl off our streets. I'm proud to have fought to include Atlantic County now as a new high-intensity drug trafficking area. But as law enforcement pursues those who sell this poison on our streets, we know that a deterrent-based approach can't turn the tide. We cannot incarcerate ourselves out of what is otherwise a public health challenge. This is an all-hands-on-deck situation. It's about giving people hope that they can get better and once again lead healthy lives. It's about caring, not punishing those struggling with addiction and mental illness. And it's about building on successful programs like here at John Brooks Recovery Center so that more New Jerseyans can break free of addiction, more families can be spared the pain of losing someone they love dearly, and ultimately that we can create a more healthy, more productive society. Thank you so much, and I look forward to hearing some of our stories.